Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. Today we're talking about women's health and the importance of putting your health at the top of your checklist. But before we get started, let's take a look at what's coming up on the show. How to cope with symptoms of menopause, getting help for breathing issues after a COVID diagnosis, plus supporting kids as they deal with the stresses of life. All that and more in today's show. If you're a woman, then going through menopause is something you'll experience at some point in your life. So joining me now is Dr. Sharon Thompson to help walk us through that change. Welcome, doctor.
Thank you.
First off, what is menopause?
So menopause is a transition similar to puberty. So we all are familiar with puberty, when your body starts to change and develop, and girls will develop periods and boys will develop. Menopause is the tail end of that for women. So the ovaries that started their hormonal production at puberty are finishing their hormonal production. Now, there's no switch. So there's no on or off. I know many women wish there was one. And so we can't tell you exactly the day you will have menopause. It's a transition, it's a phase.
Now, what are some of the symptoms that women will have to know that they're going through menopause?
It will surprise most women to learn none. So most women, the vast majority of women, have no problems through menopause at all. They were having periods monthly, those periods stop, and that is it.
And it really can happen to any age, right? Women at any age.
The average age of menopause is 51.
Okay.
And that an average means that there will be some women who go through menopause as early as age 40 would be a normal menopause, and some women who go all the way till age 60 having periods. And so the bulk of women will be around that 51, 50, 52 age.
Now, what about medications? Are there some medications that you might recommend to help with symptoms of menopause?
So when women are symptomatic, and those symptoms can be hot flashes, some women will find that their concentration or focus will change. Some women have insomnia, they have a hard time sleeping. Some women will see a change in their metabolism, so their weight will start to change. It might go up, or they may start an exercise program, not see any change in their weight at all. So you start seeing differences in your metabolism. And some of those women won't need anything at all because they feel it, they have a hot flash here or there, or they start just getting really hot all the time, and it doesn't bother them. But if it's disrupting your life, if you can't get through your day at work, if you're tired all day because you're up all night, that's where medications come in. And there are two big groups of medications that women will use. One is the estrogens. Estrogens are by far the best medication for treating those kinds of symptoms around menopause. But surprisingly, the medicines that were developed for depression, a class of medicine called selective serotonin reuptake inhibitors, SSRIs, also work well in low doses for hot flashes or menopausal symptoms.
Now, what about some non-hormonal options? What can women do in that area to minimize symptoms?
It's a great question. So the SSRIs are non-hormonal, right? And so that's a great option for women who can't or don't want to take hormones. There are a lot of herbal remedies that people will talk about as being helpful, and the studies and the data on those is a little less certain. Okay. So some women will definitely get benefit from a black cohosh or soy-based products, etc. But the vast majority of women won't see enough benefit from those.
Okay. Now, doctor, share with us how menopause affects heart health.
I love that you brought up the issue of heart health, because this is something I want to put on every woman's radar. Women are at risk for heart disease just as men are at risk for heart disease. We often think about heart attacks as a male disease. In fact, since 1984, more women have died of heart disease than men. We should think of heart health our entire adult lives. Some women who have certain complications in pregnancy are at higher risk for heart disease. Now, when you're pregnant, you're not thinking about heart disease, right, but we should, because pregnancy can impact your heart function later in life. So it's not menopause per se, but just getting older that affects heart disease. And heart disease should be something that we're all thinking about throughout our lifespan. Numbers like your blood cholesterol, your blood pressure, critical for women to know and to talk to their doctors about, because that will impact your risk of heart disease.
Well, very important and valuable information, doctor. Thank you so much for being here with us today.
Thank you for having me.
Varicose veins can be unsightly and cause uncomfortable symptoms, but there is a way to get rid of them. The team at San Diego Varicose Vein Treatment Center show us how.
San Diego Varicose Vein Treatment Center, we take care of all various needs of patients for management of their venous insufficiency. People who come here are mainly concerned about symptoms that brings them on or issues related to cosmetic concern that we can always take care of. I'm a cardiologist. I'm an interventional cardiologist. I have significant training in heart and vascular and helping my patients in those fronts. Venous insufficiency is specifically pathology in the vein walls, mainly the leg veins, where they become dilated, the size gets sort of plumbed, and blood basically rushes back into the legs where it doesn't need to be. Venous insufficiency shows itself in several different ways, specifically achiness, pain, pressure, tingling, burning, heaviness that happens mainly in the calf and in the ankle region, sometimes spasm, sometimes restlessness.
I was just not feeling very well, and heavy legs. I noticed how my legs looked, and I haven't worn shorts in years. A lot of throbbing in my legs, a lot of swelling, inflammation, and I stopped power walking, and I just didn't feel good. The quality of life that I wanted, that I expect, I wasn't having.
In years past, we used to do vein stripping, but now with the advancement of technology and so many catheter-based treatments, we can treat our patients much more quickly, much more comfortably with less downtime. The varicose veins are depicted here, and we have the ability to effectively removing them. It's a great cosmetic result. Patients love the result invariably. We have a great satisfaction by really comfortably getting this out and having the best results possible for our patients.
It's been a huge impact in my life to feel better, to be able to power walk again, to not have the swelling, the itchiness, the redness, the complications, and sleeping much better. And overall, I'm just feeling like I used to feel when I was a lot younger, and I'm so grateful for this place.
It's a privilege to take care of our patients. If somebody has some issue that bothers them and I can help them, I mean, can you imagine something better than that?
Great.
That's our plan. It's just, it comes from the heart, and I love it.
October is Breast Cancer Awareness Month, and it's a great time to remember to get your annual mammogram. Screening is important to detect breast cancer early and to increase survival rates. Stick around, here's what's coming up on your health. Getting back on your feet after an accident, and ways to get a better night's sleep. After an illness or accident, getting back to your life can be difficult. The doctors at Opelousas General's Rehabilitation Center have a team approach to assist in your recovery.
What a patient can expect when they come onto the inpatient rehab unit is to be involved in an interdisciplinary team of professionals and wonderful caring people here on our Opelousas General Rehab Unit. We have physical therapy, which is going to help them with motion. We have occupational therapy, which is going to help them with what we call our activities of daily living, or our ADLs, which are the things we all need to do when we get up every morning. Washing our face, brushing our teeth. Some have to brush their hair, others are more lucky.
Patients qualify for inpatient rehabilitation because they have a significant functional deficit. And that's what makes them available to come over here or qualify to be admitted. The holistic approach that we use to treat our patients here include a whole team of persons attending to the patient's need and reassessing it on a daily basis, almost on an hourly basis. Inpatient rehabilitation benefits the patient by providing them the ability to return back to their functional level or better than they were before whatever happened brought them here. Our goal is to make the patient as functional as we can and to bring him back to his baseline before whatever brought him here was, or even better. And we do that by approaching all of his or her medical problems and physical problems.
Everybody that comes up on rehab has had something taken away from them. I always say that they've had something they never thought would happen to them, and it's already happened. Whether it's a stroke, or whether it's an amputation, or whether they've fallen and broken a hip, and they've had their autonomy and their ability to do for themselves taken away. And we are blessed to be able to help them on the beginning of this journey, them and their families, back to their independence.
The treatment modalities for inpatient rehabilitation are global. They include physical therapy, occupational therapy, speech therapy, nutritional support, and of course medication. The conditions that respond excellently well for inpatient rehabilitation are mainly strokes, because they do give you a lot of deficits, followed by complete hip replacements and knee replacements. But also other conditions such as being debilitated and weak from an extended hospital stay due to a catastrophic infection.
Dr. Alamani and I try to not be doctors, but be healers, because that takes everything. And thankfully, we have such a great team that we're all able to help them on their emotional journey, getting through this, as well as on their spiritual journey, getting through this. And not only get better, but see better. See that they have a future where they will be able to do for themselves again.
Getting a good night's sleep is important to our overall health, but sometimes we need help in getting that rest. The experts at Integrity Treatment Solutions are here to help.
There have been times that I've heard from other individuals, you know what, you just need to get a good night's sleep and then you'll feel like you can exercise. But if you have sleep apnea, how can you exercise? How can you make those good decisions about nutrition if you're not getting good sleep?
There's an obstruction in the nose or upper airway all the way down to the throat, and the air is not getting through. So anybody who's snoring like and they kind of pause, that's because they're not breathing properly. There's treatment for it, such as CPAP.
CPAP is continuous positive airway pressure. It's pressurized air to open up the upper airway to allow that individual to be able to breathe.
If it works properly, if you look at it on a sleep study, everything will be corrected and they'll get solid sleep without all the interruption. Integrity Treatment Solutions started because I had an idea of starting a company that was catering customer service-wise for CPAP and oxygen equipment. We were not doing any insurance. We were doing all private pay, to kind of cater to those who didn't have the coverage in the first place or had high deductibles. I started from absolute scratch.
My husband came to me and said, hey, why don't we open up our own durable medical equipment company dealing mainly with CPAP, BiPAP, oxygen, and we won't take any insurance. I thought he was crazy.
Basically, I worked out of my car for the first year to year and a half.
We knew a lot of the providers here in the Tucson area who trusted in us and went ahead and sent us referrals for their patients to have a home sleep test. And if they needed a CPAP, he'd order a CPAP for them. They'd purchase it, we'd buy another CPAP, and then we just kept going on from there, and soon we added oxygen. We have dozens of masks for individuals to take a look at. We provide mask fittings here and help them identify what mask may work for them. There are reviews with all of our employees' names, from someone helping them with a mask fitting, from an individual helping them with their equipment if it's failing. I used to think we work hard to get those Google reviews, but it seems to just come easy because we all are here to work together and to make sure that that service is provided.
I did a sleep study and found out I had severe sleep apnea. I quit breathing 83 times per hour. I come running in here going, and I have insurance, but I'm like, okay, so the insurance company is giving me all this stuff and I have no clue what I'm doing. Integrity took care of me, and every time my mask didn't act right or something, as long as I was on the phone, I could get in my car, drive down here, and they can find the solution for me. And they were very kind and polite, and their customer service was beyond what I would have ever expected.
You can learn more about us at itscpap.com. We look forward to seeing you. Many of our customers are repeat customers, and we hope you are too.
We all know we need to stay physically active, but women need a good mix of cardio and resistance exercises at least 3 times a week. Make sure to integrate this into your routine to help prevent osteoporosis, heart disease, and cancer. But before we go grab those exercise bands, let's see what we have coming up. Help with breathing issues after suffering from COVID, and getting support when your child can't cope with stress. At True Health, are helping patients who suffered from COVID-19 regain their health one breath at a time.
If you or your loved one are struggling with chronic lung conditions from post-COVID residual breathing problems, you may be a great candidate for our lung rejuvenation therapy. A lot of our patients who come to see us have COPD, they have emphysema, they have asthma, they have these chronic lung issues. As you know, with any type of chronic lung condition, it only gets worse with time, and we know that. And over time, the function of the lungs will decrease with about a 1% per month if we don't do anything about this. So anyone who is suffering with this, who are on medications, they're on inhalers, they're even on oxygen, what we want to do is stop the damage and allow the body to heal and regenerate. So currently what we're able to do is actually harvest these naturally healing cells in our body. In doing so, we're able to stop the damage from getting worse, so we can overcome the trouble breathing, the need for oxygen, and all these medications that keep piling up, and reverse these symptoms that these patients are struggling with post-COVID. So currently, patients that have chronic lung conditions, all they have is medications, steroids, and then when that doesn't work, they have to use oxygen. And then when that fails, well, then there is physical therapy for lungs. And when that fails, unfortunately, if there is a part of the lung that is so severely damaged, they have to have surgery to get rid of that part. So that's all that's available. It's medications, it's masking the symptoms. There is nothing out there that is designed to repair the body and allow it to heal. Left untreated, we know that lung condition will just continue to decline the lung function over time. Post this therapy, what we're able to see is that patients will actually have an improved lung function with time. So the remarkable part about this therapy is that we have seen patients who have seen an improvement as soon as 1 week. The soonest and the fastest results that one of our patients experienced was actually immediately after the procedure. So they were able to have improved energy, they no longer needed their inhaler, and again, when we checked up on them a week later, they no longer needed their oxygen, they had more energy. It can happen that fast. The procedure is a simple outpatient procedure. Our patients are completely awake for the whole procedure and are able to come and receive the therapy and go home within a few hours. So if you are somebody who suffers with chronic lung conditions, who have had COVID, and now your lung condition has become significantly worsened, and now you're dealing with these residual breathing problems, we really want to see you, and we're able to offer you this free screening where it'll tell us exactly how progressed this damage is and whether we can help you or not. So if you are someone who is struggling with this, please give us a call. We can help you. All you have to do, give us a call.
Another way to better your overall health is to cut out the stress. It's one of the biggest issues for women, and it can create significant health consequences like infertility and heart disease. So find a stress buster like meditation and stick with it. Here's what's coming up next. How to spot if your child needs help dealing with stress. Heading back to school can create stressful situations for some kids, and the counselors at Lifeline PCS are here to support you with any concerns you may have.
Adults will notice that their child or teen is having issues if they are struggling with overarching themes of communication or not being aware. There are changes that go on with kids, usually due to hormonal changes. Those are normal and natural, but some are excessive or sudden.
They will notice changes in sleep and appetite, changes in communication styles towards yourself, authority figures, or others. Maybe even social isolation rather than engagement.
Additionally, watch for negative behaviors like excessive anger or unexpected weeping. Take threats of suicide and self-harm very seriously. Self-harm and suicidality are not attention-seeking, they're connection-seeking. They may not have the words to express themselves.
It is important to provide your child or teen with someone they can trust, like family, friends, teachers, and counselors, to reassure them that it is okay to bring up problems or emotions that may be bothering them. Speaking to a provider can help guide you in determining signs and differences.
Social media is a double-edged sword. If used in moderation as a means of communication, entertainment, or to spread awareness, it's great. However, it can be negatively impacting on mental health because of a variety of reasons, like bullying or social comparisons or physical appearance, where advertising is involved, where it can decrease self-esteem.
Research supports social media being an associated factor to the increase of anxiety and eating disorders, along with depression. Social media can have a heavy influence, whether it is positive or negative, so it is important to understand how it is impacting you, your household, and your relationships. The COVID-19 pandemic is a key factor to the rise of substance abuse and other various addictions. Working in the mental health field, we have seen a rise in the increase of various addictions, emotional and physical abuse. Before the pandemic, many have already been struggling with addictions, and we have seen an increase due to social distancing, lack of support, and other added stressors, including the rise in homelessness and poverty.
Counseling is a great tool because it gives people that validation, it gives people that support system, it gives people the ability to recognize their needs for growth and change and then be able to grow and change, whereas they might not have that on their own.
For more information, please go to our website or call, and we would be glad to help.
Thank you for joining us on Your Health. Have a happy and healthy day. I'm Erica Cardenas. See you next time.